Okay, thank you for your kind introduction. Good morning, everybody. First of all, I'm very happy to meet all of you after 4 years long turnaround of COVID. And also, I'd like to thank Professor Huang and Professor Xie for nice preparation of ACTA 2023. Today, I'd like to talk about ablation-centered combination therapy. As we all know, Asia is the birthplace of local regional treatment. ACTA is the first and unique society dedicated to tumor ablation since 2014. According to the recent review paper by Dr. Yang Ping, about 50% of paper regarding tumor ablation was published from the ACTA-founded country, including China, South Korea, and Japan. This is famous randomized controlled trial from Japan. Many Japanese researchers from 49 institutions performed comparative study after ablation, radiofrequency ablation, between resection and ablation. As you can see, the result is quite promising. There was no significant difference, even recurrence-free survival between surgery and ablation. Thanks to our contribution, ablation is clearly accepted as one of the curative treatment options for early stage HCC in the most HCC treatment guidelines. There are numerous opportunities for collaboration in multi-center trial, guideline development, and education initiatives in ACTA. Please join in any activity and contribute to ACTA development. Moving on to HCC treatment, how to win against HCC? It is very hard to answer simply, so we need to figure it out together. If I ask to ChatGPT, how to win a war, there are so many tools, more than 10, including military strengths. So that means it is not so easy. We have to consider many issues. Fortunately, we have enough weapons to fight against HCC. Ablation, embolization, resection transplantation, and radiation, and target treatment. However, there is a long way to go for winning against HCC. This is our real practice. Because HCC continuously recur almost until end of patient life. So it is very important to assess our enemy, very different type. According to the enemy, we have to smartly choose the right weapon. So careful selection is really important to achieve best result after our treatment. As Sun Tzu mentioned earlier, if you know your enemy and yourself, we don't need to worry about 100 battles. Enemy-tailored war strategy is a smart strategy to achieve the best result. For 30 years, we have lived in the frame of which one is better. So many comparative studies, treatment A versus treatment B. Which one is better? So now we have to move how to combine. Even randomized controlled trial, there is a significant limitation. It is not so easy to feel this kind of stage-centered therapy. Real world practice are performed at this 5 background area rather than simple square box. So how to combine? So we have to move this frame. ACTA is the Ablation Society, so today I'd like to touch the ablation-centered combined treatment. How to win the long war? I think the smart answer is a multidisciplinary approach. Please don't fight each other. Please remember our enemy is liver tumor, not each other. So please make a peace and save the world and save the liver. I think that our neighbor organ next to liver gives a good lesson to us. Without the good function of ventricle, atrium, and valve, and coronary artery, the heart could not show the best performance. Fortunately, heart expressed the good example: H, hepatectomy, embolization, ablation, radiation, and target treatment. So multidisciplinary approach is the smart answer. Let me touch one by one, the surgery plus ablation. I think most common indication for combined with surgery is bridging to transplantation. And second is the concurrent resection with ablation for bilobar tumor. There are many literatures proving the benefit of concurrent resection and ablation. The third indication is laparoscopy guided ablation. If the tumor is located in subcapsular area in the hepatic dome, I think laparoscopy guided ablation is better than multi-subcutaneous ultrasound or CT guided ablation. Here is one example. The recurrent tumor in the subcapsular is 4. On plain ultrasound, it is very hard to find. Even in this case, the artificial size does not work, so this is a laparoscopic ablation. We use 2 electrodes under laparoscopic guidance. And after just 6 minutes later, we can get successful ablation without damage to the adjacent diaphragm. This is our recent study. Laparoscopic guided ablation shows the similar outcome compared to laparoscopic resection. The embolization plus ablation. This is the most common practice for a pretty large tumor or the tumor with microvascular invasion or high tumor markers. TACE plus ablation is the best non-surgical combined treatment in many literatures. You can see there is no consensus how to combine, but to my understanding, the TACE usually performed first and then followed by ablation is the common practice. This is a randomized controlled trial from China. You can see the combined treatment shows a better outcome compared to ablation alone. There are so many meta-analyses from China. As you can see, the TACE plus ablation is definitely better than TACE or ablation alone. What about the radiation plus ablation? This is not so common, but most common indication, multiple tumor with a tumor which is unfeasible for radiofrequency ablation. For example, if one of tumor is located just behind the large vessel, I think this kind of combination is better. This is a recent randomized controlled trial from Korea. As you can see, proton beam therapy shows a non-inferior result to RFA. The final combined treatment with ablation with immunotherapy. Already David and Professor Zhou explained it in detail. I'm not going to say detail. The immune response of the local treatment. There are so many experimental studies. Definitely, ablation is not only effective in local tumor control, but also make the tumor incident. And there are many local regional treatment combined with immunotherapy that are all ongoing trial. And also, there are several adjuvant immunotherapy after local regional treatment, as Dr. Zhou explained. And recently, IM-Brave 000 reported shows a very promising result, demonstrating recurrence-free survival improvement following curative resection or ablation after advanced HCC. Combination of ablation and immunotherapy has shown the preliminary but promising result of synergistic effect without significantly increased risk. So we have to wait to taste the nice wine from so many barrels. So today I'd like to talk about ablation-centered combination therapy. As we already know well, ablation is always better. There are so many unanswered questions. We need to figure it out for, I guess, more than 10 years. How much to combine, how to combine. There are so many recipes. So the answer is a multidisciplinary approach. We should not forget ablation should be centered in this concept of combination therapy because ablation is most minimally invasive and most cost-effective. Sometimes less is more. Thank you very much.
Thank you very much, Dr. Liu.